more than 2 years into the pandemic, and now a new medical concern for children is surfacing.
And here to answer some of our questions is Dr. Vandana Madhavan, Clinical Director of the Pediatric Infectious Disease at Mass General Hospital for Children. Before we get to our question about COVID, what can you tell us about this mysterious hepatitis outbreak? And good morning to you.
Good morning. So we're still learning a lot about it. Since October, there have been a little over 100 cases of severe hepatitis, which is inflammation of the liver, which can present with jaundice or yellowing of the skin, the whites of the eyes, elevation of liver enzymes. And these are cases where many of the cases have been so severe that children have needed liver transplants and have needed a lot of support. In about 50% of these cases, and an adenovirus infection has been identified. But despite the fact that, there have been over 100 cases, there's still a lot of investigation going on to determine, are these all related? Is there, a common cause? It does not seem to be related to COVID. It seems to be a completely separate mini outbreak.
Kind of just answered my next question. That is, I think parents start to think, okay, what is the link here among all of these cases? Or is there any possibility that this could have anything to do with a previous COVID infection?
It doesn't seem to be related like MIS-C, multisystem inflammatory syndrome in children. These outbreaks or these cases of hepatitis do not seem to be related to an earlier COVID infection. That specifically has been looked at in all of the cases, and it has not been identified as a link.
We also want to take a closer look at the new CDC map. Berkshire, Franklin, Worcester, Middlesex, Norfolk, Suffolk, and Barnstable, they're all in red, which is the highest risk category. What do families living in those counties need to know, doctor?
So this is a huge change as this happened Thursday evening, and remembering that while even in green everyone should be vigilant, testing if appropriate, getting vaccinated, as the colors rise and go from yellow to red means that indoor masking is recommended for everyone, not just those who are unvaccinated, not just those who are at highest risk, but indoor masking and even more vigilance, is recommended. And noting that despite the lack of mandates, masking is still recommended in, places like indoor transportation venues, whether it's a train, a plane, airport, train stations, things like that.
On that note, then, we have a little bit more than a month left of school. Do you think that schools in those counties should consider bringing back their mask mandates?
I think they absolutely should, and think about it. Obviously, these community levels are at a county level, but I think individual towns and communities should look at what's going on, noting that these are markers of community spread, which means that obviously children are affected as well, and children, are in these indoor settings for multiple hours a day. Yes, the weather is warming up. Yes, windows can be open, but school mask mandates should be reconsidered again.
Okay. And most families are testing at home now for COVID. And if the results are positive, but the symptoms are mild, can you tell us, does the pediatrician still need to know? Are people reporting? What should they do?
I think it's still important to report. It doesn't have to be an urgent call. It can be an electronic message through a patient portal or a patient gateway. I think it's still important to know. So that's part of a child's history. Should there be an unexplained fever a few weeks down the road, to be able to think about multisystem inflammatory syndrome in children. It's also important to know if there are visits coming up, that a child might still be in that isolation period and might need to be converted to a telehealth visit. It is still important to know if a child is positive, but it doesn't have to be an urgent message.
Okay, Dr. Madhavan, the Clinical Director of Pediatric Infectious Disease at Mass General Hospital for Children, and also the mom of 2 boys, 8 and 11. Happy Mother's Day to you. We'll have to ask you in the future how you did that.
Yeah.
And thank you so much for joining us this morning. Have a great weekend.
Have a great one.
Thank you so much. Take care.